All right, well, welcome everyone. Thank you all for coming. I'm excited to have all these new faces here and some old. And I know, taking time out of your schedule that can sometimes be difficult, so I really appreciate you all scheduling this in. And first, I'll give you a little background on me. My name is Megan Marco. I'm a doctor of acupuncture and a licensed acupuncturist, and my background is neuroscience. I was a neuroscience major in college. I started off biology and then switched along the way to psychobiology and neuroscience. I went to Bowdoin College up in Maine, and I had some really fascinating professors there that kind of shifted my gears from being pre-med, Western pre-med, to opening my eyes to a whole nother world of helping people. After years of working in hospitals and watching surgeries and things like that, I started seeing that there are ways to help people stay healthy or help to shift them to being healthy. And acupuncture was, or is, like the epitome of all of that. When we can just reprogram the body to do different things, it's just miraculous. One of my favorite acupuncturist protocols, which I do almost on a daily basis, is actually called the 12 magical points. And some of the acupuncturists don't like that it's called magical, but it pretty much is. And so he sticks with it, that that's what this protocol is called. So what does acupuncture treat? So acupuncture treats pretty much everything. We don't use it so much for emergency situations, but even that sometimes it can help with. From the upcoming talks that we have coming, it explains a lot of what I focus on, which is I help people with quitting smoking, losing weight, anxiety, depression, allergies, and memory, focus, and concentration, cold and flu. What else do we do? Fertility is one of my specialties. I've taken advanced courses in fertility, and you'd actually be amazed at how many women nowadays have hormonal imbalances. And I work with the men also with that to get the DNA to sync up easier. I've worked with women in their 20s all the way through their early 50s with fertility, actually. So it's amazing what acupuncture can do. And that's an interesting topic too, because a lot of women that are going through fertility issues don't talk about it. So I love being there for them, also helping with overcoming after a miscarriage too, the emotions and hormone balancing. The youngest age I've ever treated is 2 months old, so I treat babies. A lot of times it's for colds. Just a couple of quick points in, out, baby's energy just shifts and the boogers go away and, and they heal up quicker. To more severe neurological things going on with kids too. Definitely have helped kids with ADD, ADHD. I've worked with mild autism. I've worked with emotions with kids a lot also. Growing pains, that's another thing I've definitely worked with. Colds and athletic injuries. And so the next topic, which I think is interesting, is how does acupuncture work? So many of you have seen this on the internet, the chart of the acupuncture points, and either it's on a sheet of paper, like up on the wall up there. Growing up, I didn't know anything about acupuncture, but more and more this is on the internet so that you can see these. And if you are kind of wondering, like, what is the pattern of this? It's pretty much the grooves in between the muscles is where these fall, because chi is, if you were to do a translation, it's pretty much the electricity that the body runs on. if you think about when someone gets a heart attack, they have those paddles and poom poom do that to the heart. It's because the body runs on electricity. And our nerves are wires that conduct electricity. So a nerve will go to a muscle and zap it, and that's what gets the muscle to move. But there isn't any reuptake system to pull that electricity back into the nerves. What it actually does is it flows out into the muscles or into the heart or into an organ, and then it's in every single cell of the body, and then it kind of surfaces up to the surface because electricity flows like water, and it kind of comes up. And so up on the surface, it then finds the path of least resistance, which is in between muscles. And that's these flows of energy. And being a flow, it's called a channel, like a channel of water. So it's a channel of chi or energy. And that's what these channels are. So they're called channels, pathways, or meridians. Those are the three terms that you'll mostly hear used, and it's all the same thing. Another term you'll hear for chi is ki. That's the Japanese word for energy. So then they say that acupuncture is at least 4,000 years old. They've just through experimenting, pressing on the points, or eventually when they were pressing with a tool, they by accident punctured through and really got the person's headache to go away. They mapped out what every single point does. And with acupuncture, we are so lucky. First of all, we're so lucky that they figured this out, this whole reprogramming system. It's basically like a circuit board, and each point then goes up to the brain and increases blood flow at specific areas of the brain to tell the brain to do something differently, and that then goes down to the body to do something different. And if you want kind of a easy way to look at it, Dr. Tan, who is the style that I do of acupuncture, he has seen all these patterns. He dug into the ancient texts and said, well, why do these points do what they do? And it's a kind of a map that is where this is the head, this is the neck, this is the chest, and you go this way. Or you can flip it like this, and this is the lower back, and then you work up this way, belly, and up that way. And with the style of Dr. Tan's, which I've been doing for the past 10 years, I've been in practice for 15 years, it works, and it has a finesse. There are many different styles of acupuncture, and I originally trained in a style where we would have put the points in the area of pain, but I don't like that style at all anymore. I shouldn't say at all, but I like Dr. Tan's style better. I did that style my first 4 years of practice. Then I did a Japanese style my 5th year, and then for the past 10 years I've been doing Dr. Tan's style, which I find has a real finesse to it. It's very gentle, and it works. And right in a treatment, especially when we're working on pain, we do imaging, we'll do a point for another area. There are no needles in the area of pain, so the person's able to move around and see that the pain went away, rather than if we have the points right in there, then they don't know until hours later when they get to check in with it. So Dr. Tan's style is called the balance method, and that's the style that I do. And then the other style that I kind of wrap into it, and Dr. Tan says, you can add in other points too, is ear acupuncture, and that's what we're going to do for the sample today. Ear acupuncture is really promoted by a group called NADA in the U.S., National Acupuncture Detoxification Association. That's what it is. And with and with NADA, the whole body is mapped on the ear. It's like an upside down baby if you look at it. And I'll hand out a picture of this, but I'll just pass this around so you can look at that. There are 5 points on the ear that reduce inflammation, reduce pain, reduce stress. But then your body will show me other things. If there's other things going on, there'll be a vein or a white spot that it'll call out for attention. Being filmed. No. Teens or kids, because the ears are more sensitive than kids. but we can do some body points as well as I'm going to show Shona.
Do you want me to turn?
You're great. So the ear points are used for stress relief. They're great for everyone. Like, I don't need to know your whole health history to do ear points, so you can always just pop in for ear points. Like if you're like, I'm just having a bad day, just pop in. It's only $25 in the waiting room, or $50 in a private room. The ear points are incorporated into the regular treatment, which we call the full treatment. The ear points are what I do with people to help with quitting smoking cigarettes, or if someone's coming off of a pharmaceutical. It's amazing how the body just gets used to stuff being there, even if the person doesn't actually need it. Like, I've helped people balance their cholesterol, and they won't need Lipitor anymore, but the body's just used to it being there, so it'll go through like flu-like symptoms, and that's no good. How are you doing?
Okay.
What do you think of your mom getting this?
You can't.
Yeah,
You can't feel it.
so when I started acupuncture school, I was like, there's no way I'm going to be able to do this, because like I don't want to inflict pain on people, but you barely can feel it, because that's something that is just wonderful about modern technology, is that I use the thinnest needles that there are. They're probably twice the price of regular needles, but I think my patients deserve that, so you can barely feel them. These are called the painless ones, is what Sarins are called. And so first off, I don't
barely a pinch.
You look good.
Dude, I bet it's a really good look. I bet it's a really attractive look.
It looks cool.
But I will attest to the fact that I did have, and I think I've shared with Megan that I had acupuncture that did hurt, and that's like, I'm gonna say, because Megan won't pound her own, she won't pound her own chest, right? Acupuncture should not hurt.
It
Right.
shouldn't, yeah. And so with acupuncture, I don't like to use the needle word, because people have so many negative connotations with that.
Right.
So,
So
I
what do
say
you call
points,
them? Oh, okay.
like we're gonna put in the points. So, you ready to try one?
Sure.
Okay.
You'll be
And
fine.
yeah, so do you have anything specific you'd like a point for?
No.
Okay.
Big thing.
Sure.
Okay. Okay. So what we'll do
In charge.
is we'll do this point right here, and just take a nice deep breath, just because it's good to get oxygen. There we go. How was it?
It doesn't hurt.
Okay.
Like, it felt like a tiny, tiny pinch at the beginning, and now I can't feel it.
And also part of what you might feel is the tube, which is for distraction, because it's like a straw. But yeah, as it goes through the skin, it might be that little pinch. But so my motto is the pros outweigh the cons. Like, there might be the little pinch, but the healing is so much deeper than that. And breathe. How are you doing with that?
Good.
Okay. Yeah, just keep breathing. It's oxygen is like this. So. I just want to make sure it doesn't fall out. Okay. So when you come in for treatments, you're going to be lying down, unless you're just popping in for the ear points in the waiting room. And people usually drift off into kind of like a meditative state, or they just drift off into a deep nap, because a lot of people are sleep deprived. So it's like they get into this really restorative nap.
Wow.
Yeah, and that's the other part that people don't realize about acupuncture, is how relaxing it is.
Oh yeah.
And they say it's like hours and hours of sleeping.
Do you have the request for him?
No.
I don't know.
Megan, does acupuncture
You're his
acupuncture
neck, huh?
work on snoring?
It can help.
Yeah.
It can help.
I know that he has neck pain.
Oh, yeah. Okay.
Yeah. That's nice. Mid.
Oh, you have those knots too?
Oh yeah.
Oh my God.
I really
had
bad.
one for like a couple weeks
They
now.
don't go away.
So what the acupuncture does too is it gets muscles to relax, that they finally get to go like that. And when you come in for a regular treatment, I have licensed massage therapists that work with me.
Yeah.
So every treatment includes a 10-minute massage.
Yeah.
You can add on longer, you can do 10, 20, or 30 minutes. The massage therapists are also available outside the acupuncture,
Mhm.
but it's, like people think 10 minutes, how can you do anything in 10 minutes? But because the acupuncture already gets the muscles to relax, they can get right
Deeper
in there.
That's great.
Sign me up.
Mhm.
How are you doing?
Good.
And sometimes they fall out when they're done, so don't worry if you feel any fallout, they sometimes do.
How long do you usually leave them in for?
About 20 minutes, but it could be 20 to 45, just
Yeah.
depending. And if anyone ever, if you feel like you ever need me to take them out, just let me know. How are you doing?
Okay.
Sometimes it's the concept of it too, like, what am I doing? This feels a little bit different. You might feel some tingling. Good sensations are warmth, tingling, sometimes a little zing, sometimes an ache, sometimes feeling sleepy. The only sensation we don't want is sharp. That means that it's in the wrong spot. So just let me know. Like there might be that little pinch when it goes in, but that should go away.
Yeah, I'm not feeling any sharpness. So good.
Isn't that crazy?
Yeah.
And now that I see what I look like,
Yeah.
That's last time. Should get a
Things
I should
growing
get
out
a
of the
bunch
ear.
these for Halloween and just come.
Yeah.
And I don't get offended at all if people fall asleep. That's totally fine because it happens every once in a while during these talks.
I'm so glad you came.
I love opening people's minds up to this because it's one of the best methods for keeping the body healthy. As the inflammation goes down.
Zing.
Okay.
Yeah, that was liver.
Well, it's good. I need the liver one. That's nice.
Ian's liver is very well
Are there
trained.
different, so each point in the ear is going towards something
A different
different?
Aches a little bit.
Oh,
and
so
hurts
interesting.
short ears.
Yeah, these 5 points have been found to have the most electrical current that goes through them. So they're the ones that like help to really balance the biochemistry of the body the most.
I want to feel it.
You can feel it?
Yeah.
You want to do the other ear too?
Yeah.
Okay. Yeah, so if you think of it overall, as inflammation overall in the body goes down, areas where it's been kind of clogged, the blood can finally leave, the old stuck stuff can leave, the waste can leave, and the fresh blood and nutrients can get in and do tissue repair. We're finding that like inflammation is the root of a lot of problems in the body. And anything that ends in itis means inflammation. So bursitis, arthritis, tendinitis, you know. You feel something? What does it feel like?
Just kind of tingles whenever I move my hand at all.
So I'm going to talk about, I'm
Oh,
talking
they're
about
just gone.
Shoney's Shin. Let me grab that.
Megan probably got him.
All right, so some of my favorite Chinese herbal formulas. So Chinese herbal formulas are typically what people think of as like these brews of teas that taste really horrible, but you'd leave the acupuncturist or Chinese herbalist office with these bags of tea that you'd cook up and you'd drink them. And we used to do that in acupuncture school, and it was fun and all that, but the compliancy is not so great. So these companies have made super concentrated tablets of the Chinese herbal formulas. So they cooked it up, they made the tea, then they dry it into a tablet. So I'll just show you what a tablet looks like. And I always recommend keep the cotton in it for absorbing moisture. So they're really small. They're that big. And this formula is a great anti-inflammatory formula for achy muscles, achy joints. So that's what that formula is. Another that's restorative formula. Another great formula is Ardesia. This Ardesia is a great formula for calming the mind. It's really good for anxiety. And I'll just show you what that looks like. It's a little bit different shape from Seven Forest Company, but they're still really small. So that's Ardesia. And Ardesia is great, like before you're going to go into a meeting that you might be stressed about, or about to give a talk, or going on an airplane, or going to the dentist. Like everyone has their thing. They're like Ardesia. Or before going to bed, if the mind is going over, rehashing conversations, all of that. Ardesia, all of a sudden, it's like, oh, all that went away. Yay.
It's herbal Xanax.
Yep, that's what people call it. Herbal Xanax,
Amazing.
herbal Ativan.
There's a couple of them actually. It's not the only one.
And the great thing with these is that they're giving your body what your body actually really does need.
Yes.
So there's a lot of natural minerals in the herbs that are in this, and those soothe the nervous system. So the body's like, oh, yeah, I'm finally getting what I need. Ilex is a favorite formula for colds, for the early sneezing, coughing, runny nose. The Ilex comes in and it zaps bacteria and viruses, so your white blood cells don't have to do all the work. The Ilex comes in and does that, and it helps you to get over the cold quicker. That's like a big part of acupuncture, is that and the herbs, that they initiate and speed up the healing process. So sometimes people are like, oh, I'll get better. Well, let's initiate it and let's speed it up. A couple more favorite formulas. Corydalis, I get people off of ibuprofen, Tylenol. Great for any kind of pain in the body. At higher doses, get them off of Percocet or other painkillers. No harmful side effects. Great for menstrual cramps, stomach pain. Yeah, it's not harmful to the stomach, liver, or kidneys. So this is a very favorite formula. Earth harmonizing is a formula that helps with acid reflux, and when like stress causes the stomach to not feel good, this gets the stress to mellow out and strengthens the digestion. Then we have herbs for allergies, and this is the height of allergy season right now, the springtime, and again in the fall. But there are people that have allergies all year round too. So Beyond Pian is the herbal formula that's aromatic. It opens the sinuses. People take this instead of the antihistamines at the drugstore because there's no harmful side effects again. So it is a natural antihistamine. And then to kick it up a notch, we either pair it with an herbal formula for seasonal allergies, which is Minor Bupleurum, or an herbal formula which is for year-round allergies like dust, mold. That's year-round. It's not pollen, so Pinellia and Magnolia. Pinellia clears phlegm, so you'll see Pinellia in some of the different formulas that are like sinus kind of formulas, or stress formulas too. When the throat feels constricted, Pinellia gets that to relax. Herbs are actually really fascinating because they're not just a chemical like a pharmaceutical. They actually have a spirit to them. A lot of times it has to do with what part of the plant it's from. So if you think of like the flower probably helps with the head, and like a leaf might help with the arms. So it's like that. And they have certain ways that they make you feel. They have like kind of personalities with them. Salvia 10, for example, helps a lot with depression. It lifts the mood. So I guess it must be a happy flower. And yeah, salvia is a great formula to just kind of carry around with you. A lot of times people think of coffee for like a pick-me-up, but salvia actually makes you happy pick-me-up.
Coffee and salvia.
Yeah. Yeah. And so it's like salvia for happy, Ardesia for calming and feeling grounding. These are all great go-tos. And herbal formulas are not meant to be taken like, you don't have to take it like a drug like every day for it to work. Especially if you're getting acupuncture. Acupuncture makes you more receptive to the herbs, to just be like, oh, okay, I know what to do with this herb. The herbs are meant to be taken when you have something going on. Another favorite is Heavenly Emperor. Heavenly Emperor is for at night when you're just kind of awake and you need to go to sleep. Heavenly Emperor is sedating, and it mellows the adrenaline, and it gets you into that restful sleep. If you're finding that you're having active dreams or even nightmares, Heavenly Emperor will get that to go away too, because often that's just the adrenaline still going on during the night. Or when people wake up at certain times during the night, sometimes it's that adrenaline that's used to doing that throughout the day, doing that at night. And so this helps it to just stay down. And then you feel more rested when you wake up in the morning. We also get a lot of herbal formulas from an herbalist in New Hampshire. These all organic tinctures, which are by the front desk. A favorite is cough release. When there's like that tickle in the throat, cough release is awesome for just mellowing the tickle so that you don't have the cough. And it has herbs in it too that help to kill what might be the root cause of a cough. Those are my herbs. Some of my favorite herbs. We have hundreds of herbal formulas.
So, when you have a patient that's on antidepressants or anti-anxiety, and the ultimate goal is that they'd like to get off the chemical formulas, I mean, we call that herbal Xanax or whatever.
Mm-hmm.
How do you approach that? Cold
So-
turkey is not a good idea.
No. Yeah, really bad idea, actually.
Yeah,
Because it can throw someone into a really bad thing.
exactly. So how do you approach that?
So the first thing that some people do just acupuncture and some people do just herbs. But the best thing to do is really to start with the acupuncture to get the body to get its own factories going.
Right,
So,
right.
like if someone's been on a pharmaceutical, those factories start shutting down for that neurotransmitter.
Right.
So we get the acupuncture to get those factories going again, and
Right.
the person's mood starts getting better and better. And then we can start adding in herbs too to help with that. There are certain herb-drug interactions with antidepressants that are important, which is that if someone is on an SSRI, Paxil, Prozac, Lexapro are some of the main ones, they cannot take 3 herbs, which I'm always aware of, which is ginseng, St. John's wort, or ginkgo. So like this has ginseng in it, so we would not give this to someone until they're off of the SSRI.
Right.
But on the other hand, salvia 10 doesn't have any of those in it.
Right.
So we look at that. Pharmacists are usually the best for knowing how to dose back.
Right.
So first we need the person to be feeling good and feeling better and better consistently. Then they can start thinking of a very slow approach to tapering down.
Right. Right.
And we do that with any medication that they might be considering coming off of.
Right.
Yeah. But I've definitely worked with people a lot with that.
Well, it's tricky, the withdrawal, to go off of those pharmas.
Yeah,
Takes a long time.
Yeah, especially the blood pressure medications and the depression medications.
Yeah.
And then sometimes, they might decide that they want to stay at a low dose, but at least they're able to cut down.
Right,
But I have
right.
gotten people off of them too.
Interesting.
One more thing just to mention is I studied in China with a Chinese doctor there, the 10 herb types. And the fascinating thing with this is it looks at the personality of each of these 10 herbs and matching it with the personality of the person. And ever since I did that, if I am doing a herbal formula for someone and I choose that their herb type is in the formula, that it just fits like a puzzle piece and the herbal formula works better. And that's really fun. So that's something else that we'll talk about. Well, thank you all for coming. And
This was great, Megan.
Thank
you.
you.
Thank you.
Yeah, so I'm going to enlist Andrea's help at the front desk. So if any of you are interested in getting that savings, just have you prepay today for the treatment, and then you can come at any point, but she can also book you an appointment if you'd like to.
Cool.
Awesome,
Yeah,
yeah,
for sure.
definitely.
Cool. Awesome.
Yeah.